Cape Town is not just a city to visit for a few days, so please plan on spending more time when you travel to this conference. We look forward to seeing you.
The Global Alcohol Policy Conference is coming up in Cape Town. The theme of the conference, Investing in People Ahead of Profits, is a really important theme for the alcohol field currently. We look around the world and we see that national alcohol policies that we know are effective in reducing alcohol harm, are not being implemented. And it looks very much as if the priority is being given to profits ahead of the well-being of people. So the Global Alcohol Policy Conference provides an opportunity for us to come together from a number of sectors, the researchers, the policy advisors, policy makers, and the advocates, to investigate ways to increase the chances that healthy public policies around alcohol are implemented. And it also gives us the opportunity to talk about the need for a stronger global response to support those national alcohol policies. So we very much hope we'll see you in Cape Town.
The good news about alcohol in Africa is that there are more abstinents than drinkers, and also that the per capita consumption is less than in other parts of the world, especially Europe and North America. However, there is bad news, and the bad news is that among drinkers, the pattern of drinking is that of heavy episodic consumption. And this is based on data from the World Health Organization. It is not surprising that the burden of disease and injury attributable to alcohol is highest in the African region. This is a region where in many countries there are no national alcohol policies, and where the industry has unleashed an unrelenting campaign to win over more drinkers and to keep them drinking.
South Africa has one of the highest levels of heavy episodic drinking anywhere in the world, and this has been shown to be linked to problems such as fetal alcohol spectrum disorders, gender-based violence, HIV and TB. South Africa has also put on the table some interesting approaches to address alcohol-related harms, and legislation has been considered in areas such as increasing the purchase age for alcohol, decreasing the allowable blood alcohol concentration for drivers, and banning alcohol advertising except at points of sale. However, most of this legislative reform has been stalled, but it's only now that we're starting to hear that there are plans to implement zero levels of blood alcohol concentration for drivers in June 2020. The Western Cape province of South Africa has a very far-reaching and innovative alcohol harm reduction strategy, and this was approved by the provincial cabinet. However, that too has yet to be approved by the provincial legislature. Industry practices such as selling beer in 1-litre containers is, I believe, also aggravating the problem we have with drinking, and has been shown through Medical Research Council research to be linked to heavy episodic drinking. Industry has also pushed back very heavily on the alcohol policy reforms that I mentioned, and the industry has also sought to establish numerous partnerships with government at local, national and provincial levels. And these have been questioned and in some cases reversed.
When we look back at the research we have done, in particular, the work done by our Alcohol and Drug Unit established the alcohol and drug patterns of South Africans from 1969 to 2019. We have shown and demonstrated the impact that alcohol has on the everyday lives of South Africans. We know the interplay between HIV and alcohol, and the interplay between alcohol and mental health and drug dependence. We also know the interplay between alcohol and violence in our country. If we are committed to improving the health of South Africans, alcohol is one of the first things that we need to attack in our country.
Cape Town is a very beautiful city nestled under Table Mountain, which is one of the new 7 wonders of the world. The people of Cape Town are very friendly and come from diverse backgrounds with roots in Central Africa, Indonesia, and Europe. However, Cape Town has very high levels of alcohol-related health and social problems. GAPC, which is going to be held in Cape Town, South Africa, promises to be a wonderful opportunity for engagement of policymakers and researchers and others to come together to discuss and talk about the levels of alcohol-related harm throughout the world and to look at strategies for addressing these problems.